Welcome, everyone. My name is Christina Kepi. My pronouns are she, her, and I'm the director of the Center for Canadian American Studies. I would like to open today's session with a land acknowledgement. Western Washington University's main campus is situated on the ancestral homelands of the Coast Salish peoples who have lived in the Salish Sea Basin all throughout the San Juan Islands and the North Cascades watershed since time immemorial. We express our deepest respect and gratitude to our Indigenous neighbors for their enduring care and protection of our shared lands and waterways. On behalf of the Center for Canadian American Studies, the Foundation for Western Washington University and Alumni, and our co-sponsors, the Ray Walpole Institute and the World Issues Forum of Fairhaven College, we are excited to welcome you today to today's webinar, Homelessness in Canada, a Complex Policy and Governance Landscape. We're really excited because this marks the first talk of our 2024 speaker series, which is called Populations Rendered Surplus in Canada. Our speaker today is Professor Anna Kopec. Dr. Kopec is an assistant professor at the School of Public Policy and Administration at Carleton University in Ottawa, Canada. She specializes in public policy and in inequality, with specific research interests in homelessness, lived expertise, democratic participation, and policy process theories. She has a current book project and considers the effects of policy on the political participation of individuals experiencing homelessness in Melbourne, Australia, and Toronto, Canada. Anna's other research has been published in the Journal of Public Policy, Canadian Journal of Nonprofit and Social Economy Research, the American Review of Canadian Studies, and the International Journal of Qualitative Methods. I would like to welcome everyone here today, and especially the students joining us from our Canada's Economy of the World class, which is led by Dr. Ted Alden. And I understand that our speaker has provided you all the students with readings and materials to make today's presentation even more meaningful and engaging. Students, should you have questions, please put them in the chat and identify yourself as a student so that we can direct them specifically as coming from the class when it comes time for our Q&A. A little bit of housekeeping will take just 2 seconds. For those of you who have submitted questions prior to today's webinar, thank you for those. We hope to get to some of them at the end. We are reserving a number of minutes at the end for a Q&A. You have a Q&A feature, which should be at the bottom middle of your screen. You can send us questions at any time, and we will do our best to answer as many as possible. We recommend that you use the speaker view as part of Zoom. And without further ado, I think I'm going to give it over to our guest speaker today, Dr. Anna Kopec. Thank you very much.
All right. Thank you so much for that wonderful introduction, Christina. Hello, everybody. Thank you so much for having me today. And before we get started, I'd also like to acknowledge that I'm presenting on the traditional, unceded, and unsurrendered territories of the Anishinaabe Algonquin Nation, that is Carleton University. When we do land acknowledgements, it's also important to consider our positionality and our commitments. I am a settler on this land, and as an educator, I am committed to centering my discussions in the effects of colonization and the ongoing colonial practices. I commit to centering discussions of Canadian policy and qualitative methods around the ongoing practices, colonial practices, and learning from Indigenous peoples in Canada about my role in perpetuating and maintaining colonial relationships and how to contribute to reconciliation in the manners and ways most beneficial to Indigenous populations and not myself or my fellow settlers. So before we kind of get into the presentation for today, Christina gave you a wonderful introduction about me, but just to give you a little bit more context of where I'm coming from today, as Christina mentioned, I am an assistant professor at Carleton University. My pronouns are she, her. I am coming to you from the nation's capital of Ottawa, Canada. And to give you a little bit of background, I did my PhD in political science, which is kind of the discipline that I'm coming from. And I've been conducting research in the homelessness space since 2015, which I guess now is 9 years ago. Time is going by really quick. So I teach a lot of methods classes as well. Qualitative methods is something that I'm quite passionate about. I'll be talking a little bit about my research, so if there are any questions later on in the Q&A around methods from any of the students or folks attending, please do feel free to ask those as well. So a little bit of an agenda for today. I thought that I would start off by centering the discussion in current events, in what's happening across many Canadian cities, before talking a little bit about the history of policy and governance around homelessness. As we know, when we think about current contexts and current policies, we have to think back to the path-dependent nature of our policies and governance and systems and institutions. So I'll talk a little bit about that. And related to the complexity around governance is also the perceptions and stigma around homelessness that I wanted to talk a little bit about before presenting some findings from my research that is now going into my book project, as Christina mentioned, that compares Melbourne and Toronto. It kind of offers us a perspective and a comparative leverage to think a little bit about how perhaps more collaborative and integrated approaches may be more beneficial. And then we'll finish off by just broadly talking about policy and inequality. So throughout the slides, you'll see that there are little text boxes where I include some citations to various bodies of work that you might find interesting if you were interested in kind of looking further into anything that I talk about today. All right, so to get us started, thinking a little bit about why we should be talking about homelessness, why this is an important policy problem in Canada, but also not just in Canada, of course, across the United States as well and other Western states. It's a big topic right now in Canadian news in particular. In various parts of the country, I purposely try to include headlines here from various Canadian cities, not just those that we would assume: Toronto, Montreal, Vancouver. I think there's one from Vancouver here, but also other Canadian cities, including Halifax, London, Ontario. We have Fredericton here, Guelph, Ontario, and so encampments are on the rise across Canada, and this is something that we are now trying to work through not post, during, but also now thinking through as we transition outside of the pandemic, in thinking a little bit about how we go about not only dismantling and evicting folks, which is what has been the common kind of approach right now, but also thinking about long-term approaches to homelessness in particular. So this is my hometown of Edmonton, Alberta. Like I've already mentioned, forced evictions are often the approach that is taken in relation to encampments across Canadian cities. We saw a rise in encampments since the pandemic, and during the pandemic, there were efforts to, in some ways increase the use of hotels or short-term buildings that were available during the pandemic, because there was this realization that shelters were an unsafe environment related to the virus. Now, this is not new, right? Shelters have always been an environment of spreading disease. However, during the pandemic, we saw there were some efforts because of the pandemic, and as we were all kind of asked to stay home, there were folks that were not able to do so. And so there was a little bit of movement around various Canadian cities to ensure more safe and accessible housing. However, since then, we have failed to really think a little bit about what we do with folks post-pandemic, now in particular around encampments, and thinking a little bit about safe, accessible, and maintaining those safe and accessible sites in relation to that. And so we haven't seen a change to our shelter systems. And this is something that myself and a lot of other researchers were thinking about in relation to what were called COVID hotels, isolation centers. What would we do following the pandemic? Now, on top of coming from the pandemic context, we also have a housing affordability crisis with increasing prices of housing, as well as the lack of supply and increasing interest rates and population growth. And so with something around more than a third of Canadians now living in housing that we deem unaffordable, this is something that is really needing to come to the agenda of policymakers, but also is becoming, and if anything, really drawing attention to the failures in our approaches to homelessness. So approaches to homelessness, and often we talk about it in relation to approaches to homelessness because of the complexity associated with homelessness. It's not just one policy area or one governance structure. In Canada, we do have a national housing strategy, which includes Reaching Home, which is a homelessness specific strategy. We were one of the last of the G7 to have a national federal housing strategy. There are also other strategies and policies at various levels of government, such as poverty reduction strategies and local housing plans that often include efforts to decrease or even attempt to eliminate homelessness. But it is often a fragmented approach with various policy areas that are often siloed from one another and then lead to this kind of patchwork of services with local approaches, multiple levels of government, and actors. And so the issues with this approach, as we know, beyond the complexity of multiple actors and federalism, is the lack of accountability in particular. But how did we get here, right? There's this path dependent nature, as I alluded to earlier, to our approaches to homelessness and the kind of crisis and emergency response, which is a characteristic of our current approach, is historic. So we can't not mention colonization when discussing policy in Canada. It's particularly relevant to us today, given the overrepresentation of Indigenous people among those experiencing homelessness in the Canadian context, as well as the abhorrent conditions of housing on reservations across Canada and the displacement of Indigenous folks, as well as the history of residential schools and ongoing colonial practices. In relation to social policy, we often point to the 90s as a time when everything changed with regards to the federal cuts to spending and devolution of housing and social assistance to the provinces, and then also in some provinces, like in Ontario, to municipalities, which led to federal provincial tensions that also led to provincial variation, and then the decentralization of homelessness to provinces, and then in many cases, as I've already mentioned, cities, as well as the third sector. And I talked a little bit about, this idea of the lack of accountability, but this is particularly important when we think about devolution, federalism, right, in relation to this idea of passing the buck, where levels of government can say, this is not my responsibility, this is a responsibility of provinces. And then you speak to provinces, and the provinces say, we need money from the feds. And so that adds kind of this complexity to it. And then you throw in there nonprofit organizations and the third sector, and you're left again with this kind of patchwork of services. So there's quite a few of us online today, so I wasn't able to make this perhaps as collaborative or engaging as I was hoping to. But I'm hoping to have each of you reflect a little bit throughout the presentation today, and in particular right now, to consider what policies interact through homelessness or in homelessness. I think about when I think that we can think about the complexity of homelessness as a social phenomenon, but we can also think about the various structural and individual factors related to homelessness, right? And so, if you think about it, it's a policy problem that's also becomes more complex given the various policy areas that are actually involved and included in it in particular. So you can think about the child welfare system for youth that are aging out of the system. You can think about the criminal justice system, the need for health services, employment, social assistance, and so many others in addition to housing. And we often think of homelessness as the lack of a house, right? So we often think of it in relation to housing policy. And it's not to say that housing policy isn't a part of it. Of course it is. But there's a need for us to think about the complexity of the problem in relation to the various other policy areas that also come into play, particularly when we start talking about the failures of various policy areas and governance structures and thinking about a response that could perhaps have more success. Which means that there's all this complexity, right? I made it look very nice and linear on this slide, but we know it's much more complex than that, right? We have federalism with the various jurisdictions involved. We have various sectors, like I mentioned, the third sector in particular, and various actors then involved. And then on top of that, the complexity around different policy areas, right? And so in addition to all of that, we have all of this governance complexity with various actors and levels of government and sectors involved. But there's also another aspect that we have to think about in relation to this, which is the perceptions and the stigma around homelessness as well. And so we can all reflect on this, right? We know the stereotypes around homelessness. We face them when we walk by folks, probably on our day to day. And homelessness was often in the Canadian context seen as an urban problem. And even as there have been changes in who experiences homelessness as well as where experiences of homelessness are occurring, there haven't been major changes to policies in response, even as we've seen increases in families, young people, members of various marginalized groups, including racialized populations, members of the 2S LGBTQ plus communities, and Indigenous folks. So we know that there are many stereotypes and neoliberal conceptions and values that serve to further exclude individuals experiencing homelessness, leading to exclusion from multiple facets of society, right? Homelessness is, in this neoliberal mindset, often deemed a personal failing, right? That leads to this individualization of poverty that then actually becomes embedded within our policy approaches and can actually ignore the systemic issues that are also resulting and influencing homelessness. We also know that NIMBYism, or not in my backyardism, is also something that drives public opinion around homelessness and therefore support for various approaches. We see this even here in the Ottawa context in relation to safe injection sites, right? And also with rising unaffordability as services are expanding and social housing is expanding outside of major cities to suburbs. We're seeing these public perceptions of, yes, we know we need this, but not here. And so the idea that this NIMBYism is also embedded within these perceptions of homelessness as well, and also therefore serves to really influence public opinion around how we approach homelessness. Now, this isn't to say that conceptions of homelessness are uncontested, right? There are several competing perspectives that range in their view of individual or state responsibility for homelessness. But it's also this oscillation between kind of being identified as undeserving or in need of compassion that is also influencing the approaches to homelessness and adding complexity to how we approach the problem itself. And so these conceptions influence the policies that are formulated, the support for them, and then also the extent to which there's this real political will and commitment behind, solving homelessness in Canada. So we often take top-down approaches to looking at the welfare state and thinking a little bit about governance and policy in particular. And yet, today I'll be talking about investigating policy more so from the bottom up, right? So there is this need to really consider how policy is actually being experienced on the ground, and in particular amongst the most marginalized. And it can contribute to our understanding of policy politics and actually point to important aspects that need further inquiry, and in particular around such a complex problem, really point to where the failures in our current governance and institutional structures are happening. And I was actually lucky that as I was wrapping up my PhD a few years ago, Michener, Sorrell, and Thurston released a very helpful piece that discussed kind of the importance of bottom-up research. And we've heard similar calls for decades from critical race, disability, and feminist scholars, right? The need to include more lived experiences can actually contribute to our existing theories and research practices when done well and obviously in partnership with those populations, and can actually inform our policies. I've since also written, this is obviously related to my motivations around qualitative research as well. And so I just recently wrote a piece about the extent to which such research can actually also help and develop our theories around political science and public policy as well. And I wanted to introduce this now because it's kind of a lead into my approach to research and also thinking a little bit about my project and where I examine how policies are actually experienced on the ground, which includes, the burdens associated with accessing certain services and the barriers as well. And so today I thought it would be helpful to introduce some of my earlier work. Like I said earlier, that is also going into my book project. And that's based on a comparative research project that I conducted in Melbourne, Australia, and Toronto, Canada. So there's a lot that we can actually learn from comparing, and I wanted to introduce some of these findings today to highlight some of the fragmentation and complexity and the various issues that I've talked about around homelessness governance, and to add a bit of context to that from folks that I spoke with. Canada and Australia have important similarities in their policy development histories, right? They're both liberal welfare states and federal systems, and because of that, there's been a lot of comparative public policy and welfare state studies beyond just homelessness in particular. Their federal systems create this complex delivery systems and siloed policy areas that I already talked about. And although I started off by asking all of you to think about the complexity around the policy areas, of course, as a researcher, I had to make some choices. And so I looked at housing, social assistance, and health policies in particular. And I'm happy to talk about kind of the comparisons in within each policy area across the context in the Q&A. I conducted over 100 interviews with individuals experiencing homelessness, as well as service providers and policymakers in both cities back in 2019 and 2020. And then because of the pandemic, obviously had to also include 2021 and go into kind of the year after that. Originally, this project was supposed to be a three city comparison, and New York City was supposed to be that third case, but of course things had to change, which is okay because here I am talking about Melbourne and Toronto today. So I had to focus on those three policy areas to kind of limit the scope of the project, but it's still extremely complicated, as we know, because each policy area includes various other policies and services within it. And so these are just within both contexts, the various policy areas that I looked at. And I wanted to know the barriers to access and experiences with these various policies and services from the perspective of folks experiencing homelessness in particular. I asked questions around how certain policies are accessed, right? How they're delivered. And I had to come up with a list of criteria, if you will, or policy characteristics around which I would kind of evaluate and examine each of these policies within each broader policy area. And so just to give you a little bit of background into what that criteria was, these are the kind of the policy characteristics that I focused on within the policies from that previous slide. And so existing literature on policy design has pointed to the importance of these characteristics. It's quite embedded within the literature, but these were also aspects of policies that folks spoke to about in particular in relation to the burdens associated, as well as the fragmentation of delivery. And so the delivery design here is related to implementation. I called it delivery design because that's what individuals experiencing homelessness called it, as well as service providers. And so thinking a little bit about the method and the process, but also how accessible something as certain policy or service is in relation to visibility. You know, I spoke to a lot of folks that just talked about this complexity and the impact of that complexity on really the visibility of the services that are available. Folks talked about the fact that they don't know where they have to go in order to, you know, even gain shelter, or thinking about social assistance. Where do they go? Where are the OW offices? So that it kind of puts that governance complexity that I talked about a few minutes ago in perspective of folks that are on the ground trying to navigate these complex systems and services in particular. And so the reason why I introduced this is because these are the three policy characteristics where I found variation between Melbourne and Toronto, which means that although Canada and Australia have similar limitations related to social assistance policies that require, you know, you to be eligible around income and have similar criteria. They also both have universal, although in Australia it's mixed, but universal public healthcare systems. Where the variation came in is how visible some of these policies and services were to folks on the ground, as well as how they were delivered and whether or not they were integrated. So, kind of wading through that complexity to think about where and how certain services could be integrated with others to make it easier for folks to access. And so these were kind of the main themes that came from those discussions with folks about these different policy areas. The visibility of services, actually, in both contexts, was something that everyone talked about, although folks spoke to services being more visible in Melbourne compared to Toronto. The eligibility of all services, in particular, social assistance, the burdens of proof that are needed with that were talked about. And I think an important one, especially coming from the Canadian context to talk about, is kind of the barriers to universal programs. Canadians, and we are, of course, it's something that we're quite proud of oftentimes, is our healthcare system and the universality of it. And yet we need to also keep in mind that there are limitations related to it in relation to, in particular, marginalized populations and the lack of targeted services that can actually lead to the inaccessibility of our universal healthcare services. There are also limitations to mainstream services, in particular, that folks spoke to me about at length. There are also housing limitations. We know this: affordability, but also choice, and then also just stock that's available, and then the fragmentation and silos of services. Now, in comparing Melbourne and Toronto in particular, I started to realize that there are different approaches, in particular around emergency responses in Melbourne compared to Toronto. So in Toronto, we have a similar style to the kind of US model of shelter systems, with kind of, serving as an emergency housing situation where there are oftentimes bunk beds or cots in a large area. Whereas in Melbourne, shelters don't exist in that same context. It's more so what they call crisis accommodation centers, where there's more individual space and privacy, whether it's a room or it is actually a full, like, bachelor suite or apartment style housing in particular. And there, yes, it's still crisis accommodation. It's actually the first emergency form of housing that's available to folks, but it's for 6 weeks. And I noticed that at times they were areas of integration. And so in Toronto, we had shelter systems with limited integration. So not only are they crowded spaces, but they also actually lack the integration or the accessibility of various other services. And so, although at times, let's say there would be a doctor would come, let's say, once or twice a week and for an hour or so at a time. Whereas in Melbourne, in these crisis accommodation centers, there would be dentists that are there full time. There were services that were targeted, healthcare services that were targeted, including nutritionists and podiatrists, things that just did not exist in the Canadian context at all. The other aspect that I'd like to highlight is that there were social assistance workers in Melbourne that actually traveled to crisis accommodation centers to help folks with their applications for social assistance. Whereas in Canada and in Toronto, you had to physically either go to an OW office, which is our social assistance or welfare office, or have to kind of navigate the online system. And so there were limitations around that integration, but also in relation to how targeted certain services would be to folks experiencing extreme poverty. And this is something that we need to think a little bit about in relation to the expectations that we have of those that are currently experiencing homelessness or extreme poverty in navigating that complexity that we talked about, right? If there's a lack of targeted services, then folks are forced to access mainstream services, right? And given the perceptions that I talked about earlier, how the stigma, there are major stigmas associated with accessing these mainstream services. And so you could think about how being able to see a doctor within the crisis accommodation center in Melbourne would be a much more welcoming and inclusive experience compared to kind of going into a walk-in clinic, let's say in Toronto. And that's what folks spoke at length about with. So I've chosen just a few quotes here from those I spoke with that illustrate some of the effects of those more integrated approaches. And so this first one, I must say though, the people I've used at the specific health clinic are much more inviting, much less judgmental. So I've used the physical therapist and exercise physiologist here, and I've also used podiatry. Another participant, not only are workers great, but everything is in one place. And then another, you could see them at a location where you feel better than at the central location. And this is in reference to social assistance in particular. So the fact that there are outreach workers that actually travel to crisis accommodation centers rather than folks having to go into the specific welfare office in particular. And now, although I am presenting Melbourne as, this more positive, if you will, approach to homelessness, this was not the case across Melbourne and across services. So I was able to travel both within but also outside of the CBD or the Central Business District in Melbourne. And that's where I kind of also saw this variation within services just within the city itself in relation to kind of the accessibility and the integration of services. So as soon as you kind of leave that Central Business District, that design and that integration in particular changes. And there folks talked about the inaccessibility of medical services, having to go to appointments very far away. And also the idea that, it wasn't easy to access services because they weren't located within the one location in particular. And so even in Melbourne, and I stress this, right, there's still this idea that it's still patchwork and it kind of does depend on the services that you access as well as the location of those services. And, there are still very much the similar issues as in the Canadian context around mainstream services not being equipped to handle various targeted issues, whether it's around healthcare or mental health, but also in relation to just accessibility to the population in particular. And so that delivery and visibility characteristic, as I talked about, how I kind of frame it in my research, is thinking about not only in relation to, accessibility and effective services, but also as actually being opportunities or creating more inclusive spaces that actually lead to more engagement with the population in particular as well. And so thinking about our services not just around providing that service as areas of service delivery, but especially when we're talking about folks that are accessing these services on their day to day, right? And oftentimes multiple times in a day with various different access points, the effects that has also on quality of life and inclusion, and perhaps also starting to counter those stigmas and those perceptions that I talked about earlier. And so given some of these elements that I've outlined, right, given some of the findings that I talked about in relation to Melbourne and Toronto and that variation, I want to encourage you to kind of reflect on what would be needed for more integrated comprehensive services, right? And I say this because I know it's no small task, right? And given the governance context that I set up in the intro and that history, we know that it requires this complex web of actors and policy areas and sectors, but also the need to think about neoliberal values and perceptions around homelessness. And so, it requires us to really shift gears and thinking a little bit about how we approach homelessness, how we think about research around the welfare state, how we really perceive of kind of some of the perceptions in particular around homelessness, right? And there are very real political limitations that we need to think about around the electoral cycle, right? Parties in power, whether it's variation across provinces or thinking about different parties being in power at the provincial versus the federal level, right? And then also other issues around power in terms of municipalities in Canada have very little power in thinking about taxation, but also resources and the capacity of different actors and what that would require to really think about a comprehensive approach. And so it leaves us with a lot to consider. And I'm now starting to look at other welfare states like Finland, where chronic homelessness. It's actually the only context where chronic homelessness is on the decline. And so thinking a little bit about what would be needed in the Canadian context, right? And thinking a little bit about those relationships and services and policies and actors that I kind of talked about earlier. And so there would be a need for, you know, requiring more collaboration between actors and jurisdictions and industries. And it's important to note that the need for more comprehensive and collaborative responses it's not new, right? They've been referred to by various scholars, activists, and policy actors, especially in the homelessness space. And in addition to thinking about collaboration, though, as scholars highlight and as we know in relation to federal systems, there's a need to also ensure there's accountability mechanisms around who's involved, what their roles are, but also the transparency of those roles. It also requires resources, and we know this, right, from all levels of government. It is a fact now, and there is data to back it up, that it's actually cheaper to house an individual than it is to, have them remain homeless in relation to the various services that they would be accessing, right? So if we want to think about this in relation to resources, it is very much switching that emergency response instinct to thinking about more long-term approaches to that. And there are examples, even within the Canadian context, where this has been found effective. The most recent example that actually I found, or that was kind of highlighted just last week, I think, or even this week, was the example in Fort McMurray, Alberta, where rather than having this forced eviction from an encampment, there were partnerships that across various sectors and organizations and jurisdictions that led to 29 encampment residents actually being housed, and were not housed, being connected with the services that they needed. And not just in the short term, but actually sustained support and collaboration across service providers, even in the moving of residents out of that encampment. So rather than this police response and forced eviction, there was this, hey, let's all collaborate and think about connecting folks with the services that they need. But it did require some of the complex collaborations that I've mentioned. And so in thinking a little bit about homelessness, but also all policy areas, right, there's a need to think about the relationships to history and institutional structures, that kind of history that I started with in relation to devolution, federalism, as well as that decentralization of responsibility and kind of the gaps that creates in our welfare state in particular. But also this idea that we should start to question the generosity of our welfare state, right? The fact that if we provide services, but there is no uptake in those services, or those services are actually invisible, to what extent can we still be claiming that our welfare state is in fact generous, right? And the idea too of shifting kind of the perspective and the expertise and the evidence that we're using to think a little bit more about the experiences on the ground and the extent to which those experiences can actually help us evaluate the role of policy in maintaining and perpetuating inequality, but also thinking about the extent to which that is actually policy relevant expertise. And so my current research is moving on to thinking about lived experiences of homelessness and the extent to which they're being included within policymaking or not, and the benefits to doing that, right? Especially in thinking about really combating the extent to which our policies right now are failing, right? And also in relation to policy integration, obviously one of the main benefits that I found, and there's a big body of literature now that's moving on to thinking about policy integration in relation to various complex social problems, whether it's homelessness or climate change and others, and thinking about how policy areas and different actors can come together to really think about social problems more collaboratively and form a more coordinated approach. And policy integration in particular, and I stress this when I speak to policymakers, because it's not just about the approach to homelessness, but it's actually the quality of services that are impacted, right? If you think back to the quotes that I shared, the quality of services had impact on how included folks felt, the services that they were able to access. So just in thinking about integration in relation to those other policy characteristics, all of a sudden policies became more accessible in relation to the delivery. They became more visible as well, right? And then, so again, just to kind of finish off and thinking about how we think about expertise around policy in particular, and thinking about the extent to which we can start to engage with lived experts on the ground to think about where our policies are failing, also where they stand to be improved in particular. And so I think I will finish there. I will just say that I have two current projects, just in case this might encourage some questions from folks. I'm currently working through this integration visibility aspect of homelessness policy and governance in Toronto still, and looking at mapping all of the services that are available for folks experiencing homelessness in Toronto in particular. And I'm working with research assistants with lived experience of homelessness to thinking about the services that might be accessed, what the barriers might be, and thinking about, that complexity and making it actually visible, not just in relation to, academics and policymakers, but thinking about that complexity on the ground and hopefully making them more visible to folks. So I'm happy to chat more with all of you about all the things I've introduced, as well as some of these things that I finished off here with. And yeah, I encourage any Q&A. Thank you so much.
Thank you, Anna, for that wonderful, wonderful talk, and gives us a lot to reflect on, for sure. We have a number of questions, and some of them I can kind of like package into one, but I'll start off with one that is a little bit rather specific, and it is about the relation between addiction issues and programs for homelessness in Canada, if you can speak specifically to anything in that regard.
Definitely. And so thinking a little bit about harm reduction services, there are various different approaches, and it will depend on kind of the service that you're accessing, as well as the context. And so in British Columbia, in Canada, on the western side of Canada, there has been a lot of movement around harm reduction. That was kind of one of our pilot cities, if you will, Vancouver in particular, that had the first safe injection sites. We've also seen that we have them now across Canada. Within shelter systems, there's variation in relation to that. But I can talk a little bit about from my experience in the field when I spoke to folks. Addiction services, in particular in Toronto, were very hard to access. So folks talked about having to be on wait lists or having to go way outside of Toronto in order to access specific addiction services in particular. So there are major barriers to that. The other issue is that because of our emergency response system, our shelter system is actually not very good with thinking through the complexity of addiction in particular. So in order to stay in a shelter, folks are forced to remain sober. And if you're caught using any sort of substance, then you're kicked out, which then obviously serves to reinforce and really fails to help any individual with regard to thinking about their emergency housing, and then also on top of that, various addiction issues. So it's kind of a complicated area in particular with regards to the services that are available, but I can say that it depends on where you go. There's also elements of around the perceptions of, as we know, addiction in particular in Canada. This is very much the case, similar to, I'm guessing, the US as well, in relation to how we approach addiction and how we understand it, as well as the services that are available. But I would say that's probably one of the weakest points of, in addition to mental health, in our healthcare system. So not really an answer, Christina, but as close as I can get.
That's good. We have two questions that have come in from our students. And I think I will I'll relate both of these questions at once, and then you take your time in answering those. So the first question reads as follows. Do the crisis accommodation medical services in Melbourne include mental health services? How comprehensive and accessible are those services in Melbourne and Toronto? So that's the first one. And then second one reads, in Melbourne, what do people do after the 6 weeks in the crisis accommodation centers once that is up? Are there follow-up services available? And how do people leave shelters in Toronto? What is available there?
Two very good questions that I will again answer as much as I can. So, in relation to crisis accommodation centers and mental health, yes, that is something that I should have highlighted that I didn't. There are mental health services that are on site within those integrated services that I mentioned in particular, including psychologists and psychiatrists, as well as counselors and various therapists. So those are very much included in Toronto. Not at all. Actually, of course, I had to choose certain quotes and experiences from the field that I shared with you today. But if I could add one in Toronto, actually, I spoke to someone who talked about the fact that, yes, there's a doctor that comes in for an hour once a week, but we really could use like a psychologist or a therapist to really talk things through with and to help us in that sense. So that's very much lacking in the Toronto context. Actually, access to mental health in Toronto was so limited. In Melbourne, where folks almost, I would say a majority, over 60% of those that I spoke with actually did access mental health services because of how accessible they were. In Canada, that was like in the single digits. There were barely any folks that accessed them, not because they didn't want to, but because there just weren't enough of them. In reference to the 6 weeks in relation to crisis accommodation, great question, because this is probably one of the biggest limitations related to crisis accommodation centers in Melbourne in particular. After 6 weeks, it depends if there is availability, you're able to stay longer and kind of start that 6 week process again. The goal of that 6 weeks is that it's within those 6 weeks, there's a hope that more permanent accommodation is found. If not, you are sometimes having to go back to a central intake area to then go to a different crisis accommodation center. And so there again, there could be variation. You could go to one crisis accommodation center for those first 6 weeks that has all these integrated services and then be moved to another that doesn't, or that is further away outside of, the community that you have. And so that's a major limitation. I wish I could say that folks are housed following those 6 weeks, but that is not the case. In Melbourne, they're also facing a major housing affordability crisis right now. The other thing is around choice, where folks could be told that there's a shared housing that's available. And they're kind of, if they don't take it, then they go back again on that 6 week, start that 6 week cycle once more. And so I spoke to folks that had children, or that would have children visiting them, or just had various other preferences around, not wanting to take shared housing. And so they would have to kind of give that up in particular. In Toronto right now, I just did some field work in Toronto in October, and it kind of depends on the shelter. So some shelters have strict rules around length of stay. Others, you're allowed to stay up until you find housing, or until there's something that kind of changes your status, whether that's kind of the rules and regulations of that shelter or something else that might occur. And so there are folks that stay in shelters for months at a time. And yet there are also other shelters where it's kind of bed to bed, night to night kind of scenario. So it depends on what you access. And so again, in Toronto, there's this one central intake. You call that number, or you go to that service, that office, and you're kind of told where there's availability. And depending on that, you have to kind of adapt to the regulations of that said shelter. Hopefully that answers those questions.
Thank you. We have a couple of questions that have come in that I'm going to package up with one that also came in from our professor, Ted Alden. And essentially, they are looking to see if you can speak to the challenges faced by asylum seekers or migration and increased immigration on homelessness, as we've seen in the United States, if you have any comparison as well here in Canada.
Yes, thank you, Christina, and thank you, Ted, for that question. This is something that I've been thinking more about now, after I came back from the field in October in particular, because I had the opportunity to go to a shelter in downtown Toronto where it is home to 200 plus residents. And I did a focus group there where everyone was either had asylum seeking status or refugee status. And just the state of the shelter. If I can speak a little bit to that, there was on the women's side, because there's a separate men and women's side, there were over 120 residents and 3 washrooms. So the conditions were just absolutely dire. And so there are impacts around the emergency housing situation, but there are also, again, this complexity is translates to thinking about immigration as well. During those focus groups, folks were asking me questions around, how do I get a work permit in Canada? And so just the lack of information and visibility of even where folks go once they land in Canada, and how do they maybe start to access different services, but also how do they go through collecting their legal documents and ensuring that they're able to do what they need to do to you know survive or live or even work in Canada in particular. So there is a strain also in Canada right now. There is related to the housing affordability crisis, international student crisis, where international students are also now not able to find affordable housing, which is leading to international students within our shelter system, as well as international students staying in crowded housing that is inadequate. And so all of this is definitely creating issues around housing, but it's also because those failures were already there, right? So as much as they're contributing to thinking about our housing affordability crisis and our homelessness services, it's also because the system has been completely ill-equipped for decades now.
Thank you. Thank you. Another question that seems to be quite popular and so I'm going to package it up again. And you mentioned at the beginning that you had hoped to conduct some field work in New York City. And in true style of us being the Center of Canadian American Studies, a lot of our folks joining us today are interested in wondering if you have any insight into any of the comparisons, whether it be, the origins or the causes of homelessness, how they differ between the countries, any of the policies, successes, in implementing policies and results, anything as sort of that they can sort of reflect upon, being here in the United States.
Definitely. I mean, I think there are quite a few similarities in relation to the complexity that I pointed to, right? The federalism element in particular, the different levels of responsibility as well. Um, so when I had chosen New York City, the assumption was kind of that Australia would be, or Melbourne would be kind of that most positive case. Canada would fall somewhere in the middle, and New York would that was my assumption going in, would be the worst. But I do think that it's important to note that I'm talking about these broader approaches. I'm talking about, the folks that I spoke with in particular, but there are success stories around more collaborative approaches. Housing first in New York City, it's where the housing first approach was kind of coined, and where it was piloted. It was in New York City with major success around housing and long-term housing with supports for folks with mental health issues experiencing homelessness. And that was then, housing first became something that was then adopted in Canada in certain cities as well. And we had a whole pilot project across 5 different cities. And so there are definitely successes around that. And I think the similarities are that those successes really do focus around some of the issues that I talked about around more comprehensive services and more collaborative and coordinated approaches to homelessness in particular. So I can't speak too much to that comparative element, but I do think that there are important similarities both with thinking about history and institutions that are important to think about in the American context too. Of course, the kind of institutional racism that's also existent in Canada, and thinking about various populations and marginalized populations that would be overrepresented among those, in thinking also about housing affordability, history of redlining, and things like that, that would be important to also think about in the American context.
Thank you. I think we have time for one more question, and before I get to that one, we have a comment here that came in not from one of our students, but from someone who is doing PhD research in Edmonton, and I'm not going to read out their question or comment, but I'm wondering if you would be willing to if she could contact you if she is interested in doing some research on homelessness as
Yes,
well.
please,
So,
please.
okay. So,
Anyone interested in this area, please reach out. I love
thank you.
talking about research and helping in any way I
Okay.
can.
Thank you. So I think the last question, there's so many to choose from, but I did promise that I would give first dibs to our students. And so this one reads as follows. Are there mutual aid organizations operating in either Toronto or Melbourne that aren't federally organized that have gained traction?
Mutual aid in thinking about, I'm thinking a little bit about the nonprofit sector. There's a little bit of work going on by the YWCA in Canada. Not so much in Melbourne. There's quite a bit. There's a lot of philanthropic organizations that are involved. St. Vincent being one of them that kind of comes to mind. There really aren't many. There are many local, smaller organizations that are kind of taking this coordinated approach in particular. And then there are kind of these broader networks or coalitions, the Canadian Alliance to End Homelessness being an example, that are working towards really bringing service providers together and having more coordinated approaches, but none that really come to mind. But that could be one of those questions that as soon as I leave, I'm like, oh, I should have said this. So you could follow up with me also over email when I have a little bit of time to think instead of, being on my feet right now on the spot.
Thank you, Anna. Thank you so much. Well, this concludes our first of 4 talks of this year's speaker series. Our next one will be taking place on February 27th, and our speaker will once again be speaking to us from Ottawa, and actually speaking to us on the decolonization of a building in Ottawa, which is the former U.S. Embassy, so 100 Wellington. So if you're interested, the link to that registration is going to be put into the chat. And so just to close off today, I would love to thank our wonderful speaker, Dr. Anna Kopec, and from all of us here at Western Washington University, the Center for Canadian American Studies. And we also wanted to thank our sponsors and our partners, who are the Foundation for Western Washington University and Alumni, the Ray Walpole Institute, and the Fairhaven College of Interdisciplinary Studies. And for those of you who joined us today and chose to support us, thank you so much. We appreciate your love and support. There will be a recording available that includes Anna's slides, and her contact information, I believe, is on that last slide, if I recall. So you can check your inboxes soon. So thank you so much. Have a wonderful day. Thanks again, Anna.
Thank you.
Thank you.